Since the arrival of Omicron, Saskatchewan has been the outlier when it comes to implementing restrictions. Every leader in a province or territory in Canada put in some sort of safety measures, but Premier Scott Moe didn't. Even Saskatchewan's top doctor, who directly advises the Premier, stressed the importance of limiting gathering sizes. So why won't Moe budge? Or do these decisions hurt or help him politically? Jim Farney is the director of the Shoyama Graduate School of Public Policy, and he joins us now. Well, Jim, when we look at other provinces with conservative leaders, they're making decisions to put in safety measures, and Premier Moe is not. What is driving this decision?
I mean, I think the conservative piece is still a really important thing. Like, yes, Alberta's done some stuff, and yes, Ontario's moved in directions, but ideology matters, and it's a government that does not like, as it would put it, interfering in people's lives. So that's a really big chunk of it. We're also, and I don't think we talk about this enough, we're also a much more rural province. And I think to a big part of the Saskatchewan Party caucus, that means this looks different than it otherwise might. To be honest, the puzzle in the response to me, and there's lots of good policy debates to be had, so let's just put those aside to 1 second. Usually this is a government, it's a party that's very good at political communication. They've not been good at political communication through this whole thing. Like the press conferences have been confused. As you said, there were pieces about, Shahab having different pieces of advice. That's not usually how they operate. That whole part of the operation has just not been tight for the last 6 or 8 months.
So now today we saw that the Premier is not going to change his mind. Now, what do you think would prompt him to lift these restrictions in Saskatchewan? Is there anything that would make him go back on this?
I mean, it seems clear that what they're driving at is hospitalization, and that they're really planning to run the healthcare system as far into overload as they can, with the goal of keeping everything out and open. Without putting it in as many words, that's what they've said that they'll do. The problem is, on the outside, seems to be that many folks in the healthcare system are already saying we're in overload. And I've got to admit, it's a bit of a mystery to me what, moving, say, restaurants to 50% capacity or shopping to 50% capacity, the economic harm that would do, right? There'd be some, but it's not massive. So I'm a little bit unclear on the cost-benefit analysis, but the political trajectory is pretty clear that we'll stay as open as we can for as long as we can. And what they were saying this morning is that they'll start paying attention to hospitalizations rather than case counts. Other provinces are definitely not going that route.
Okay, let's open up the history books. How will historians write this chapter in Moe's tenure?
I think we'll probably talk about two pieces, and it will be one of those benefits of hindsight. One thing that we've learned in each wave of the pandemic is that it looks very different in the middle of it than at the end. But I think, it's interesting being the odd province out when you bet wrong, as we did in the fourth wave in the fall. We bet wrong and we're an outlier. Not a good thing. There's all sorts of celebration in BC in the first wave when they bet in a different direction, right? And I think the government is betting big that Omicron is in fact different. And I'm not a public health expert. There is some evidence that that's not completely out to lunch, and there's lots of other voices that says that it is, but it's clear that they've doubled down on the idea that Omicron's different, it's less severe, and so they'll manage with that in mind. The biggest single decision I would say is keeping schools open, and that the evidence on that is very complicated, right? Because the risk to children is quite limited, and we're trying to balance that off against learning outcomes that are long-term, mental health outcomes that are long-term, keeping especially women in the workforce, right? That decision is pretty fraught, and we've watched Ontario bounce back and forth in the last 2 weeks over it.
All right. Well, thank you so much for your time, Jim.
Thanks.
That's Jim Farney. He's the director of the Shoyama Graduate School of Public Policy.